Welcome everyone to today's webinar, 3 Strategies for Health Systems to Cut Through the Noise and Get the Most Out of Their Data. On behalf of Becker's Healthcare, thank you for joining us today. Before we begin, I'm going to walk through a few quick housekeeping instructions. We will begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. If at any time you don't see your slides moving or have trouble with the audio, try refreshing your browser. You can also submit any technical questions into the Q&A box. We are here to help. With that, I am pleased to welcome today's speaker. Anna Daly serves as the VP of Data Analytics and Innovation for Conduent. In her role, she leads the predictive analytics and cloud technology solutions for the healthcare provider group. Anna is also a recognized thought leader within the healthcare industry, where her focus centers on the expansion of clinical data management and business intelligence strategy, all with the goal of helping her clients and providers understand the value of clinical data and the effect that it has across the healthcare continuum. Anna, thank you for being here today, and I'll now turn the floor over to you.
Thank you for the introduction, Ayla. I know all of you attending today are busy with a multitude of other projects and initiatives, and I really appreciate you spending some time with me. And we're going to just talk about some strategies I've used in the past to reduce the noise in the data that you work with every day. Just to start right into it, just reading over the bullet points on the screen, you can really easily tell healthcare is swimming in data. Every industry has seen major advances in the production and collection of data, as well as the ability to effectively analyze and understand all this new information that's being thrown about at us. Just think about the strides healthcare has made over the last century on our own brain power. Now with the influx of big data, the field of medicine is prepared to push the boundaries even further and faster. I think we can all agree that this has never been more evident than what we've seen and experienced ourselves over the last 9 months with COVID. Data from every facet of every industry is coming at us seriously. Yet we sometimes still lack the ability to truly make sense of it all because we don't know where to start or where the finish line even is. So medical researchers and physicians often have access to vast amount of data that didn't exist 2 years ago or even 6 months ago. We now know the value of including socioeconomical data, environmental factors, biomedical, molecular, genetic information, and then along with that, the overwhelming evidence that how our behavioral health status plays into a patient's outcomes. This mountain of data quickly becomes overwhelming, and so many people are taking a more is more approach. This results in a lot of data noise. It's leaving those of us left to consume this data without a clear path to action. We are often left with unusable or unactionable data, or often the choice of too many options. So basically, we're swimming in an ocean of information with no tow line to get to the right shoreline. So there's no lack of use cases for this volume of data. I'm sure each of you can think of at least 10 reasons why you would want meaningful data for your organization. Whether it's to improve patient outcomes, the experience, reduce administrative burden on your clinical staff. These are just some samples of things that you could look at. Maybe you're looking at predictive analytics. You want to increase access to care in outpatient settings. Maybe you want to look at genomic and prescriptive approaches to preventative care. Or you're reevaluating your value-based care contracts to reduce cost. Real-time alerting while the patient is still in the bed. As a clinician, we always refer to this as butts in the bed. But, really being able to get to that patient while you can still take action on them. Reducing the cost of care to the patient. Evaluating patient staffing ratios for optimal care. Again, COVID is front and center in that. Management of chronic conditions for ongoing patient wellness. And then most near and dear to our hearts again is continually reviewing and assessing emerging trends. COVID-19, the flu, how are those two things going to mesh together? The hardest task that we face is to annotate integrate, and present this complex data in an appropriate manner for better understanding, so that it makes sense to those responsible for acting on what they're reading. In the absence of clarifying all these complexities, the healthcare care data remains quite cloudy and may stop many users and researchers in their tracks. So it's really critical that we catalog and curate the information into a consumable layer that can then be translated into visualization tools to effectively display all of this newly gained knowledge. So let's just jump right in. Information is the key for any health system, provider, clinician, and other administrative support areas, payers, supply chains, and HM to ensure consistency in results and meaning. The more information we have, the more optimally we can organize ourselves and to deliver the best care and outcomes for our patients. As we're becoming more and more aware of this, we've started producing and collecting data about almost anything and everything imaginable. We're introducing new technologies in this direction, whether it affects the patient's health and wellness or not. So, think about it. Today, we have the ability to collect data from wearables, from IoT, purchasing patterns at Walmart, social media posts. And so we're just inundating ourselves and facing a situation where we're flooded with tons and tons of data from every aspect of our lives, whether it's really meaningful to the patient's health or not. In other words, we're introducing noise. We have to learn how to reduce this noise that can distract us from our goal of improving the care that we're providing to our patients. We really need a streamlined approach to address this data deluge. Successful analysis is required at various levels, depending on the urgency of the situation. So at all of these levels, the healthcare professionals are responsible for the use of specific information, such as the patient's clinical data, administrative and costing data, modeling, predictive analytics, to determine where the patient lives today and how we are going to best address their needs. All levels of data and situations have to be drafted together in a sequence that flows seamlessly for the data audience. This audience is only capable of absorbing and moving on certain amounts of data at any given time. So we're going to review 3 strategies I have found successful to reduce the noise in healthcare. Those 3 are: start with the end game in mind, focus on the patient, well, at least in context, and know your audience to keep them engaged. So starting with the end game in mind, what does that really mean? Well, that means knowing what you want to get out of your data and plan for that for tomorrow. Let's just talk about, Potter, what's working for you today and what's not? How well is it accepted? Is it really being utilized in the manner that you thought it would be? How relevant is the data that you're using today? As I've already shared, data is changing rapidly. Just because it was relevant last year doesn't mean it still works today. What are you missing in your displays of data and your exchange of data, and why? Is it because the data doesn't exist? Is it because you can't get to that data? Are there limitations to what you can do with that data? I always try to think of approaching any health analytic initiative by looking at how it can support any of the goals that are part of the quadruple aim, meaning reducing costs, improving population health, addressing the patient experience, or the latest one that was added, improve the healthcare team well-being. Each of these goals require data-driven decisions that you can't make without taking a hard look at your data. What's your source? Is it valid? Is it still valid when it may have been valid last year, but is it still valid today? How many sources are you using, and how are you aggregating those together? What's the format? Is it standard? If it's not standard, why? And what's your plan of getting to some level of standardization? Interoperability, of course. How are your sources integrating for a seamless exchange of information? Cleanliness of your data. Garbage in, garbage out. Not only is it clean now, but how do you keep it clean? Applicability. Does the data have context to what you're using it for? And appropriateness. Do each data set you're using belong? And how are you continually evaluating that? Curation and cleansing of your data is the foundation of creating a data-driven strategy in which decisions can be made. Nothing is truer than the old adage of garbage in, garbage out. Unfortunately, more often than not, we put data in, but we don't have a cycle to continually review it for relevance, cleanliness, and appropriateness. Just to kind of give you a personal example, I've experienced where I was asked to do a review of a legacy system for hospital reporting. And over the years, the team had developed over 30,000 metrics going back to 1998. And they had a tendency just to add to the list, but they didn't edit it down for relevance, context, or appropriateness. So the result was diminished user satisfaction with the product, as well as an overwhelming cleanup task when it was finally decided to address the problem. If we don't start with the end game in mind, which is the data, we will never get the results we're trying to achieve long term. But now that you've got all this data, don't try to eat the elephant all at once. I would love to suggest you read Edward Tuffy's Principles of Envisioning Information. In it, you learn how the human brain can really only process approximately 10 visual data elements at any given time. So make sure you're curating your metrics carefully to not overload your users. Sometimes more is really just more. So throwing everything on a screen at one time only succeeds in confusing them. Keep your design simple and easy to use. Over several years, I had a colleague that used to refer to this as the Think Angry Birds approach. So anyone can open the Angry Birds app and within 3 minutes easily figure out with a few key instructions the objective of the game, how to navigate on the screen, and if you're like me, how easy it is to lose. If it takes a manual for you to train someone on how to use your visualization, you've done it wrong. Along with a simplistic approach, you really need to adopt a mantra of fail fast. One of the beauties of modern visualization tools is that they're easily adjusted. If you have graphics or metrics that aren't effective, they're not easy to understand, or they're just not widely being adopted, drop it, move on. Look at your audience, look at what they're driving towards, and create net new metrics that are meaningful for them. Not every KPI is going to be adopted. Not every KPI is going to be acceptable. Use what works and drop the rest. So the second point, speaking of elephants, which part of the elephants do you want to scope out first? So being a clinician, I tend to focus on the patient first. However, being patient-focused does not always mean that the data or metrics are directly patient-related. You need to try to focus your attention on key challenge areas where you can really make a difference quickly. Get a quick win in. Trying to deliver too much information is counterproductive, and it further distracts the users with too much noise that's not actionable. If not focused correctly, assumptions and associations of unrelated data can be made that's going to result in the wrong data being reported. While data in and of itself is not either good or bad, the biases we place on that data and the associations can and do tell a story. So if we aren't careful about that story we are telling, and that in healthcare, my view is the patient is always the center of that focus. Providing succinct and easily absorbed data analytics will ensure your users stay within your guided path. Driving clinical outcomes by disease process or a pathway is a great example of focusing in on the patient. A pathway approach can allow you to see the patient outcomes and quality performance measures in a single view while allowing for easy identification of problems areas. Focusing on costs can do a deep dive into coding practices or areas of high spend. Narrowing down on administrative practices can improve both cost and outcome performance while identifying challenges or bottlenecks in workflows. All can be successful, but the key is limiting your focus and delivering data that is meaningful and actionable. So here's a recent example that my team has developed. It's related to sepsis. So sepsis affects approximately 1.7 million adults in the United States each year. and potentially contributes to more than 250,000 deaths. Various studies estimate that sepsis is present in 30 to 50% of hospitalizations that culminate in death. Per the CDC, early detection and intervention to prevent the spread of bloodborne infections is the main defense to curtailing rising mortality rates. Additional data can provide individual hospitals more insights related to financial impacts or total cost of care for the patient, as well as the administrative burdens those hospitals are incurring to prevent additional spend. A deep driving insight into a single focus area like sepsis can have direct impact on patient outcomes, provider performance, and the health system's profitability very quickly with minimal impact to staff and IT resources to put that into place. The visual display of healthcare data is a science, just like medicine. Learning about the patient and continuing to ask questions about their journey doesn't stop upon that patient's diagnosis. In fact, often the diagnosis is just the starting point. Well, the same goes with analytics. You should continue to add new variables and parameters into your models and equations to better understand your patients or the health systems, or how those health systems are performing over time in a phased approach. In addition, drill-throughs and filters can add variable insights and information to take your users to the next level without cluttering the screen with noise to interrupt their path. So the third strategy that I always like to use is just know your audience. You know, the quickest way you can lose your audience and drown them is to show them data at the wrong level. You need to understand the level of your audience and what they're expecting to do with that data. Don't present a senior executive dashboard with the expectation that that user is then going to export that data and perform some sort of deep analysis. Know who you're presenting to and target to that level of understanding. We often speak about role-based security, and I would apply the same concept here, role-based dashboards. If you're delivering the right meaning, you have to deliver the right meaning to the right role that's consuming it. Make sure you're thoughtful to present the data in a manner which guides your user with an action. Be direct with your navigation. Don't leave them guessing to where the most critical item needs their attention on the screen. Colors have meaning. Often these are subliminal, but think about what the colors red, green, and yellow mean to you. Did you have to think about it? The same principles apply, so don't make something red unless you really want to draw attention to it. Be considerate that you're sending the right message with your color schemes. And don't present data just for data's sake. Overwhelming your consumers with volumes of data, 67 data elements, 32 metrics, 15 different filters. You will have them shutting down their dashboards within minutes. The visualizations have to be meaningful. They have to be pertinent to the role, and it has to be something that can call insight to an action. So one of my passions in life is cooking. And I've often heard the phrase, people eat with their eyes first. So that also applies to the sharing and the absorption of data. Design matters. The use of color, visual representation, and positioning, they all matter to the user, and all can affect the absorption and the actionable nature of the data represented. And it can all be used to help reduce noise. But don't get caught up in perfection. You are never going to please everyone with your design, and that should never be your goal. Design is always subjective. But there are a couple things that you want to keep in mind as you're working with graphic designers and your developers. First and foremost, color blindness. You've got about 5 to 8% of the population suffers from color blindness, with the predominant being males who are considered red-green colorblind. Using the right amount of color in your designs. Please don't use more than 5. It really hurts the eye. And a good use of visual cues to draw the eye to challenge areas quickly, the red, green, yellow scenario. Use arrows, data positioning, and keys to move the eye in critical areas that need attention immediately. Make sure you're matching the right data types to the right visualization so the metrics make sense. Not everything makes sense in a pie chart. And as you can see from the example that I have here, a line graph can really end up looking like a pile of string that my cats have just played with if you are not careful. Use a critical eye to select the right display for your data. And make sure you're using that eye with the colors that you're choosing. A lot of things look different in grayscale than they do once colors have been applied. So look at it from different angles, look at it from a different viewpoints, and add different views from your team members into there. So every person is going to see something different, and something different will be brought out for them that you may not see yourself. Delivering the appropriate amount of data at a time. So really closely analyze your time variables. Do you really need to show 2 years of data at one time for this to be effective? Think about the amount of time that that data capture and that data harvest is going to affect the refresh of your data. And really, what is effective by metric or relevant by metric? And yes, you can use different time frames for different quadrants or portlets or widgets within your dashboard so that you can actually show a predictive or a predictive analytic next to a retrospective. Shoot for the user never being more than 3 clicks away from the guided answer, if at all possible. I mean, this really takes a lot of time. It takes a lot of careful crafting. And what is a drill through to a new dashboard? And what's going to be displayed on the screen upon opening? You want to make use of the data timestamps as well as breadcrumbs in every single dashboard. You want to make sure that you're allowing the user to travel easily in and out of different segments of your visualization so they always know where they came from and they can get back there easily if necessary. So reducing the noise. This was a short and sweet presentation, but I wanted to make it that way so that we could really get to the meat of what your questions and answers might need to be. So to wrap it up, following some simple strategies, many of you are using today already. I'm sure you've already noticed some of the things that you have in your everyday lives that you're utilizing with your own dashboards and your own reduction of noise. But let's start with the end game in mind. What are you doing today? How is it working? And how do you make that better to plan for the future? Focusing on your patient, or even if the metrics aren't directly patient related, focus them on a single subject line or area of interest to keep your user engaged. And know your audience. The quickest way to lose them is if you don't know them. Reducing the noise that can distract us from our goals of improving the care that we're providing our patients can increase inefficiencies or can decrease the inefficiencies in our organization and ultimately help us reach that quadruple aim that I spoke about earlier. So I want to just stop my portion of the presentation or my chatting here with a quote I found several years ago. It's attributed to Atul Butte of Stanford School of Medicine. And I found this to be very insightful to me as I travel along my journey with clinical data management and business intelligence. But hiding within those mounds of data is knowledge that could change the life of a patient or change the world. I don't think that this is any more true than it is in our current environment. We are living today in an unprecedented time of data deluge. And it's more important than ever that we all learn to dance to the noise of the data. Because data is not just noise, and crafted in the right way, it can be beneficial to our patients, beneficial to our hospital systems, and it actually can be quite beautiful to improve our overall health and wellness of our lives. So with that, I am going to open it up for questions. And I believe we've got some folks on the line who are taking those questions and are going to shoot them my way.
Yes, thank you so much, Anna, for a great presentation today. And we will now begin today's question and answer session. And just as a reminder, you can submit any questions you have by typing them into the Q&A chat box on your webinar console. So let's go ahead and get started with the first question that we have for you today. And let's see here. This person is asking, as outside consultants, where do you go for metrics to share with organizations to use for comparison and improvement targets?
So as an outside consultant, if you're working within a health system itself, a lot of times they will have a vendor that they work with to do comparison data. We often will go to publicly available sources such as Hospital Compare. My organization alone, we've created our own comparison data that we use across our 2,200 clients. But that is a challenge so that you can look at yourself nationally and what your rankings are. I would first shoot for publicly available sources such as Hospital Compare. That would be my number one go-to.
Thank you so much, Anna. And we had another question come in for you, and this person is wanting to know, how do you get the most out of your data science team when attempting to solve a problem through analytics or data science? Basically, what process do you use?
So, there's a lot of different ways that you can approach it. Data science guys, brilliant folks, and they really like to dig into the nitty-gritty very, very quickly. But I always like to follow the CRISP model. It's critical for business understanding. It clearly defines what the problem is and what you're trying to resolve. First and foremost, a CRISP model helps you understand what data is available, what are the required data points, how do we get access to it, and then you go through the next step of cleansing the data. A lot of the stuff that we've already discussed here, making sure the data modeling is where your knowledge and your meaningful insights are created, choosing that right data for that modeling process, make sure you're including an evaluation step in there so that the modeling goes through and is tested, and then you reevaluate, you test again, you reevaluate. And then finally, once you've honed in on the proper response or the resolution that you're expecting, then really deploying that in an effective way so that it's tested on new data and see how it performs based upon what your modeling process was. They're all cyclical. You can bounce in and out of these at any point in time, but I think that's the most well-defined model that I've seen used and found to be very, very effective.
Thank you so much for walking us through that and providing, like you said, what you found effective to work and working with the data science team. We had another question come through for you in the meantime, and this person is wanting to know, their question is, during your presentation, you focused on operational data, but as a market researcher, we typically use primary survey data and focus groups. Are there any tips specifically for primary market research data?
That's one of those new areas that's coming in that is not traditionally used in the healthcare environment, but is extremely, extremely valuable. I think as we're moving more towards price transparency, that's going to even be more valuable. From a survey data perspective, it's also really hard to kind of merge that in with the encounter level data or the clinical or administrative data that you often see in health systems or the membership data that you have in providers. So there is a huge challenge there. And how do you apply that survey data to the correct populations in which you're looking at from a health system lens? I think, though, that we are on the cusp right now of making that data extremely valuable because we're moving into consumerism. And the more we move towards consumerism in the healthcare space, the more that survey data, that marketing data is going to be exposed, and the more valuable that is going to be for the health systems and the patients themselves to make better decisions for their care. Like I said, I have found it to be challenging to use surveys to this point, because it's really hard to do the matching. But I see that changing very, very rapidly over the next 2 years, if not before then, just because the transparency rule that's getting ready to come out in January, because of the consumer plays that are happening as a result of telehealth and all of the nuances related to COVID.
Thanks, Anna, for sharing your experience and also just what you're expecting moving forward with the new rules and what's going on in the industry right now. I want to make sure we get through at least one more question. And this person is asking, just how do you approach a revenue generating project, whether it's to build predictive analytics or a software application? Do you go big or do you release it in phases?
I am a big fan of phases. So I really like to go with an MVP or a minimal viable product approach. I also am a big fan of Agile. I think most anyone who works in clinical data management or in business intelligence these days are. But the key is to try to deliver something early and often to your clients in a minimal feature set to market test it and validate in real time. You know, as I mentioned earlier, most of these visualization tools are easily adjusted. So that really does give you an opportunity to try it for trial and error and to fail fast. So, you know, going out with a beta client or even going out with an alpha client to really test the waters, understand where their challenge points are and meeting those with a minimal viable set of metrics and data and figure out what works and what doesn't. You know, that gives you a very clear understanding of, are you meeting the mark, or do you need to just scratch and start over again? It's really tempting in the tech world to add all the bells and whistles and the pretty shiny things up front to try to impress users. You know, I would really try to avoid doing that. Get something out there that works. At the end of the day, something that works will win out over the pretty shiny bells and whistles every time. Be dependable to your clients, and that will gain you far more than showing the latest technology. You know, you also have to understand, just because you build something, it doesn't mean it's going to be immediately revenue generating. Sometimes it takes time to build it up for it to be successful. But taking a phased approach allows you to do that very thoughtfully. It allows you to move in a direction and continually show progress to those that are paying for that, so that they feel like they're getting their money's worth. You know, and just really accepting feedback humbly. If they don't like it, they don't like it, and that's okay. Let's just fix it.
Thank you so much, Anna, for walking us through that. And I think we've had several more questions come in, so I want to make sure we get through these before the top of the hour here. But the next person is wanting to know, just could you expand on how to use the Agile Framework?
So the Agile Framework is just that. It's a framework. It is not a one-size-fits-all. And so everybody tries well, at least in my experience, people try to use Scrum and Agile interchangeably, and they're very, very different. Agile is a listing of 12 different principles that you use to develop software. And you can take from that what you can that's going to work for your team, and really devise a path or a plan that is meaningful to your team and that works for your team. But the most important one to me is always, you know, delivering progress, showing progress, or delivering on a regular basis, and constant reevaluation and self-evaluation, as well as product evaluation, to continually grow. So I don't like it when people think, okay, well, we're following Agile, and that means that this is a set of rules that we're going to do, or we're going to follow every day of our lives through our software development life cycle. And that's not the case. It is strictly a framework. Take what works for you and grow with that. And if it doesn't make sense for your organization, then that's okay. It doesn't have to. It is something that is very malleable and can work within any organization if it's if it's put in properly.
Got it. That makes so much sense, just a framework to follow and trying to make it work for your organization. The next question we had come in, this person was just wanting to know what was the name of the book regarding principles of providing visual information?
It is Edward Tufte's Principles of Envisioning Information. It's been out for quite a while. He is the preeminent expert on it, a professor of visualizations, I guess, as it were. He's done a lot of studies around how much data a mind can absorb. What is the best way to approach data so that it is the most easily absorbed? I learned of him probably 10, 12 years ago and didn't really understand or know that that was even a thing, that there were entire focuses of science related to how the brain accepts and processes data, and there were effective ways to do that. It was very life-changing for me. In my professional life, it was. He's a very interesting gentleman.
Sounds like it.
Great insights out of that book.
Thank you so much for sharing the title, and I know a lot of people listening in will definitely want that to check it out as well. Sounds incredibly interesting. I want to make sure we get through this last question here that came through for you. And this person is just, they're asking, there are a lot of dashboards and visualization tools out there, and you had a few images on your slides. So they're asking if you have any advice on what to think about or guidelines when selecting a tool, or should they do it in-house?
The buy versus build conversation. There are a tremendous number of tools out there. I have a tendency to lean to the buy versus build because there's a reason there's a lot of them out there, and they spend years and years of expertise building those things for a reason, because it's hard. Let them go ahead and go through the hard stuff, and you take advantage of it. One thing I will say about that is in large organizations, I've never seen the use of just one tool. Whether you're going to go through a mix of Power BI and Tableau, or if you're going to use MicroStrategy in some kind of ClickView product, Cognos, some other newer products like Burst that are well, they're not necessarily new, but they're not the traditional enterprise applications. They all have very unique aspects about them that work for different parts of the organization. I've always found my data scientists love Tableau. That's one of their favorites. They can load a Tableau server underneath their desk. They can wipe it, and they can move on and create very autonomously with it, and that works really well for them. There's other applications that lend themselves better to an enterprise situation, whether that be through their licensing model, their storage and capture models, or how they're just architected themselves in their data wrangling capabilities. But I do have a tendency to lean very heavily towards the buy side of the house. Building a reporting solution or a BI solution in-house is extremely difficult, even with the technologies that we have today. And unless you've got the right guys sitting in those seats, you're going to miss something. So I always lean towards the buy.
Thank you so much, Anna. I think thanks for walking us through that and sort of why you lean towards the buy side. That is all the time that we have for today, but I want to once again thank you, Anna, for your excellent presentation, and thank Conduent for sponsoring today's webinar. To learn more about the content presented today, please check out the resources section on your webinar console and fill out the post-webinar survey. And thank you for joining us today, and we hope you have a wonderful afternoon.
Thank you so much.